laxatives. Describe the mechanisms of action, types, doses, side effects, indications, and contraindications of the drugs used as laxatives. A man of 50 years presents to a clinic with symptoms of difficulty in passing stools, having 3 bowels in a week, dry or hard stool, pain and cramping in abdomen, bloating feeling, straining when passing stools, and can't completely empty the stool from rectum, suffers from nausea and loss of appetite. Doctor advises a fiber-rich vegetarian diet and he prescribes laxatives and asks the patient to come for a review after a fortnight. Constipation is generally a failure in bowel movements for various pathological conditions, because of which stool passes infrequently or there is some obstruction of bowel movements. Mechanism of action of various types of laxatives. Laxatives are a group of medicine that generally work on the mechanism of stimulating the colon movements. They also work on the principle of retaining water and electrolytes in the intestinal lumen. Based on their mechanisms, laxatives can be divided into stimulant laxatives, bulk-forming laxatives, saline and osmotic laxatives, chloride channel activators. Stimulant laxatives. Mechanism of action. Anthraquinone derivatives, example senna. Senna is a plant fiber. The fiber is poorly absorbed and normally after hydrolysis in the colon, it produces a bowel movement in 6 to 12 hours if administered orally. Senna stimulants bind to the receptors in the epithelial cells of the colon. This binding causes a cascade of reaction in the epithelial cells of the colon, because of which it causes active secretion of water and electrolytes into the lumen of the colon. This leads to fluid accumulation. The filling pressure of the intestine is raised by this augmented volume. This stimulates the enteric nerves to increase peristaltic movements. Doses. Senna syrup. Children of 2 to 6 years. 2.5 to 7.5 ml per day in 2 doses. Children of 6 to 12 years, 5 to 15 ml per day in 2 divided doses. Adults above 12 years, 12 to 100 milligrams per day in a single dosage. Side effects. Prolonged use of stimulant laxatives can be dangerous. It can cause nausea, diarrhea, urine discoloration, burping, increased flatulence, fluid and electrolyte imbalance, hypokalemia after regular use. It may produce colonic atony, brownish pigment of the colon, also called as melanosis coli. Indications. Senna is used in patients suffering from chronic idiopathic constipation, irritable bowel syndrome with constipation, and opioid-induced constipation. Contraindication. It should not be used in pediatric patients and pregnant women. Diphenylmethane derivatives, example bisacodyl. Bisacodyl is an organic compound that is used as a stimulant laxative drug. It stimulates the enteric 6 to 12 years, 5 mg tablets at bedtime. Above 12 years, 5 to 15 mg tablets orally at bedtime. Side effects. Abdominal cramps, hypokalemia, pseudomelanosis coli. Indications. Bisacodyl can be used in the case of chronic idiopathic constipation, irritable bowel syndrome with constipation, opioid-induced constipation, contact laxative, and bowel cleansing. Contraindications. It should not be used in the cases of patients suffering from appendicitis, acute inflammatory bowel disease, severe abdominal nausea and vomiting, and intestinal obstruction. Bulk-forming laxatives. Mechanism of action. These are indigestible, hydrophilic colloids that absorb water from a bulky emollient gel that distends the colon and promotes peristalsis. Psyllium. Psyllium is a plant fiber and contains natural colloid mucilage, which forms a bulky gelatinous mask by absorbing water. It is largely fermented in colon and increases bacterial mass and softens the feces. Because of this, there is distension which causes the enteric reflexes to increase bowel movements. Doses: children from 1 to 3 years, 19 grams per day. Children from 4 to 8 years, 25 grams per day. Adult male, 38 grams per day. Adult female, 25 grams per day. Pregnancy, 28 grams per day. Side effects: bloating, gas, cramping, rarely gastrointestinal obstruction. Also increases constipation. Bacterial digestion of plant products can cause bloating. Doses: children from 1 to 3 years, 19 grams per day. Children from 4 to 8 years, 25 grams per day. Adult male, 38 grams per day. Adult female, 25 grams per day. Pregnancy, 28 grams per day. Side effects: bloating, gas, cramping, rarely gastrointestinal obstruction. Also increases constipation. Bacterial digestion of plant products can cause bloating. Indications: it is used in the case of constipation. It lowers cholesterol levels. It helps in irritable bowel syndrome in the case of diabetes and high cholesterol. Contraindications: hypersensitivity, acute abdominal pain, nausea and vomiting, GI obstruction, and fecal impaction. Symptoms of appendicitis, ulceration and dysphagia, and rectal bleeding. Osmotic laxatives. Mechanism of action: as the name indicates, osmotic laxatives work on the principle of osmosis. They are normally soluble but non-digestible sugars or salts which increase the osmotic pressure in the colon, thereby drawing water into the colon, because of which there is increased fluidity of stools which causes distension, which in turn increases bowel movements. Non-absorbable sugars, example lactulose. Mechanism of action: lactulose is broken down in the colon by bacteria to osmotically more active and weakly acidic products. This decreases the pH in the colon. The decrease of pH increases the osmotic pressure within the colon, thereby drawing water into the colon. Ammonia in the blood gets into the lumen and is converted by the bacteria into ionized ammonium salts that are not absorbed. This also causes laxative effect, thereby moving the bowel quicker. Doses: children less than 1 year, 5 ml per day. Children of 1 to 6 years, 5 to 10 ml per day. Child 7 to 14 years, 10 to 15 ml per day. Greater than 14 years, 15 to 45 ml per day as prescribed by the physician. Side effects: diarrhea, gastric distension, abdominal cramping, flatulence and bloating, vomiting and stomach pain, pulmonary edema. Indications: constipation, hepatic encephalopathy, pregnancy and breastfeeding, opioid-induced constipation, irritable bowel syndrome. Contraindications: Crohn's disease, ulcerative colitis, inflammatory bowel disease, gastrointestinal obstruction, symptoms of alcohol withdrawal, lactose intolerance, acute kidney failure. Non-absorbable salts, example milk of magnesia. Mechanism of action: milk of magnesia seems to stimulate the release of cholecystokinin, which leads to intraluminal fluid and electrolyte accumulation, which leads to draw water into the lumen of the colon. This increases intestinal motility. These actions result in more rapid transit of gut contents into the larger bowel, where distension promotes evacuation within 3 hours. Doses: children from 2 to 5 years, 2.5 to 5 ml per day. Children from 6 to 12 years, 5 to 10 ml per day. Adults, 7.5 to 15 ml per day. Side effects: abdominal cramping, bloating and flatulence, nausea and vomiting, and diarrhea. Indications: constipation, hyperacidity, acidity, hypomagnesemia. Contraindications: hypermagnesemia, lower potassium levels, renal insufficiency, dehydration, appendicitis, blockage of stomach or intestine, kidney dysfunctions and problems. Chloride channel activator. The epithelium of the intestine has several chloride gateway channels. CCA acts on these gateway channels and cause increased secretion of chloride-rich fluid into the intestine, which stimulates bowel movements and fluidity of the stools. Mechanism of action: lubiprostone enters the gastrointestinal lumen and binds with the receptor and initiate a cyclic AMP pathway, thereby activating CIC2 chloride gateway channels, which open the channel for chloride. Sodium and water also enter into the lumen through various intercellular junctions. This leads to firing of the enteric nerve fibers, which in turn initiate vigorous bowel movements. The fluidity of the stools further help in colonic laxation and quicker passage of stools. Doses: adults 24 mcg twice daily before meal. Women above 18 years 8 mcg twice daily before meal. Side effects: nausea, diarrhea, syncope and hypotension, and dyspnea. Indications: chronic idiopathic constipation, irritable bowel syndrome with constipation in females,